Hi, this is Dr. Sassy. Today I want to talk about something that affects a lot of men, especially as we get older, how the prostate can cause leaks or trouble when peeing. Think of the prostate like a donut sitting under the bladder. The tube that carries urine out, that's the urethra, goes right through this donut hole. As men age, the donut gets bigger, and that squishes the hole, making it hard for pee to come out all the way. That's why some men dribble, leak, or feel like they need to pee all the time. The bladder just can't empty like it used to. This can happen from something called BPH, or a prostate infection, or even after treatment for prostate cancer. It's really common. About half of men over 50 deal with it. But the good news is there's help. At home, you can try Kegel exercises, manage what you drink, and avoid bladder irritating foods. If medicine doesn't cut it, surgery often does, and it's very safe. If you notice problems like leaking, waking up to pee, or a weak stream, don't wait. Early treatment works best and helps you keep living life to the fullest.